Hello, I'm Barry Schreier, president of Army and Navy Academy, and today I'm honored to be here with Dr. Wade Licup. Wade is a graduate of the Army and Navy Academy class of 2010. He's walking now into his 15th year reunion. He had an opportunity today to talk to the cadets. It was a beautiful discussion. I'm going to let him go through it in greater detail, but he had a great discussion, and he specifically referenced honor, courage, and compassion. And it was the boys absolutely ate it up. We know because they couldn't stop asking questions. Today, Dr. Wade Licup.
Thank you again for having me in the podcast. So I was able to share with the boys about my story, my times here as a cadet, and some of the values that I distinctly recall and that I thought were formative as for who I am in my journey. And as you mentioned, the values that I spoke on was honor, courage, and compassion. And just to kind of share a little bit what that speech was, so for honor, to me has always been like a abstract value, but it really is very important and it can mean everything. So I shared a story when I was a cadet, third year, got in a little trouble for leaving campus, got some Jamba Juice, and then the sergeant major at the time made me do a punishment. And the punishment enough was to instill the lesson of honor, doing the right thing even when it's hard. Then for courage, that came about during my medical training. So I stepped up to do whatever I could during the COVID-19 pandemic. And I distinctly remember always showing up to those formations, do discipline with the parades, even when I didn't want to, showing up to do things I was a little nervous and scared about. So just day by day here at school, I learned about courage. And then compassion. There was plenty of opportunities for service, both through our classes, through the JROTC, extracurricular programs. And that compassion clearly showed up in my career as a physician. And I'm just proud to say that the seeds of these values really started here. And I was just happy to have an opportunity to speak to the boys and share my story and show them what life could be like after school.
That's great. When you spoke to the boys today, one of them, which I thought was very apropos, one of the boys asked, "Did you want to come here?" Mm-hmm. And you very quickly said, "Well, my parents were really helpful there." Mm-hmm. And I think it's very great for you to share that.
Yes. So thinking back when I was just a young teenage boy, I mean, school is sometimes on my mind, sometimes wasn't on my mind. So if I was truly truthful, the real answer was I wasn't even thinking about school. But I wanted to highlight my parents because it's that mentorship and guidance. And because, of course, when you're young, sometimes it's hard to know what you really want. It's life beyond your immediate day-to-day is very abstract. But I also wanted to tie it back that even if the things that happen to you or the things you go through aren't necessarily what you want right away, you can realize that there's a lot of value in good things. And sometimes in life you have to do things you don't want because there is some value or something at the end of it. So hopefully I was able to communicate that.
I think you did. This is a difficult thing culturally for us. I mean, obviously people they like to do what they want to do, mm-hmm. right? There's an old quote that's oftentimes attributed to Winston Churchill, although there's really no attribution for it. It's, when you're going through hell, yes, keep going.
Keep going.
And there's a lot to say to the boys about, look, there are things that are going to be adverse, things that you just don't really care for, you don't like. But the key to it, and I think you made a beautiful point here today to say, you got to keep going. Mm-hmm. You've got to just work through it. And you made a beautiful point about saying, look, I wasn't sure what I wanted to do. I left here, you went to Pepperdine, mm-hmm. and you said, I didn't really have a clear path set out for myself, mm-hmm. but I just kept going.
Yes.
And I think it's great for you to elaborate on this idea that you found it.
Mm-hmm. Yeah, so I shared to the boys that at the time, I didn't quite know. I had some ideas, but I didn't really have the path right in front of me. And even when I went to Pepperdine, I meandered a bit. But just by, when I shared to the boys, showing up, doing your best, you will find your way. And I think the values at Army Navy, they really served at least guides so that there was something to always come back to. And then eventually, through a mix of situations and mentors, I was able to find my way. Something that I was passionate about, something that I thought was worthwhile doing, and that would help me do the things when the times were tough. Because when you find that path, there are still parts that you don't want to do. I mean, when I was trying to become a doctor, I mean, there were some days I just like, I don't want to study right now, but I had to because the end goal was worth it. So yes, I was able to find my path by recalling kind of my foundation and values, and it ended up working all right.
And you talked to the boys today about service, about you actually going to the Philippines. And for those people that don't know, the Philippines is a series of islands and dialects.
Right.
And there are some places that are particularly remote.
Yes.
And you went there as a physician and you were the only one there and had 3 nurses with you. And I think one of the things that wasn't lost on the boys was your desire to perform that level of service and commit yourself to others, because you made it very clear that compassion is a requirement of humanity. And I'd love for you to be able to go into maybe even greater detail about that trip and really give us a sense of how that was formative for you.
Absolutely. I'd love to go into detail about this because the logistics and planning and getting ready for the trip was actually one of those things I didn't like to do. Not every part, I had to ask for donations for our nonprofit. We had to coordinate with the other group, get this and that. So everything leading up to it was a little challenging, or at least not the fun part. But then once we got there and once I saw the people, it really changed because there's nothing quite like seeing and experiencing it for yourself. And yes, as you mentioned, some parts of the Philippines are quite remote, very rural. And I shared to the boys that the things that, being here in a beautiful Carlsbad, San Diego area, having all our first world amenities, it's true. They don't have it, or it's too expensive, or it's just difficult. So experiencing that and seeing that was really eye-opening. And I just thought to myself, really, if luck or God had it, I could have been in that situation. How would I know any better? So I just felt like it was a duty, and it would have been a beautiful thing to share what we have with those people.
Yeah, that's beautiful. And I think the boys, that resonated a lot with the boys. We talk a lot about service, and most schools do, but it's a little different when they feel it a little bit more. But with stories like that, that really require commitment, because that's a little different than going down the street and being helpful.
Right.
Of course, this was months and months of effort.
Yes.
And it affects you deeply. You come back with a very, very different perspective. Yeah, I think that wasn't lost on the boys at all.
Right.
So let's talk a little bit about go forward. We've had a chance to talk about your time here, how formative it was.
Yeah.
And what brought you to today, 15 years post-graduation. What are your plans moving forward? What do you think?
Yeah, so at least immediately from now is, of course, continue to go do good work. So currently I'm a local physician with Scripps Health. So that's kind of my day job, what I'm planning to do. And then I find myself, as I mentioned, kind of returning to those values of showing up, doing my best, because I've kind of found myself somewhat I was volunteered into and somewhat I did accept it as well, consently, about doing more of a leadership and administrative work. So in my own clinic, we're doing quality improvement projects. This is when you meet with committees, you get feedback, you do things, you measure, intervene. Can you improve certain things, inefficiencies, all those things? So just finding myself deeper and deeper into the system and trying to affect greater change beyond just my one-to-one time with patients, which is still beautiful, but how else can I serve and make positive change? So that's how I'm finding myself.
Are you seeing cultural change in your practice? Do you think that your patient base is more receptive to the types of things that you're talking to them about? Is it harder? Are they paying more attention or less attention?
That's a good question. In one aspect, it is just very individual. But when I think about my patient panel, I'd say most people, they have their own beliefs and opinions about whatever, whether it's healthcare, politics, how to go about in life. But then I found as a primary care doctor, when you establish that relationship and get to know them, then you're in a better position to meet where they are and then maybe positively influence them. Whether that's just, hey, you need to take your medication more often. Hey, why don't you think about exercise or stress reduction? And then even sometimes to the bigger things, because I see patients throughout their whole lives. So I've seen people have changes in their marriages, kids, work situations. So when you work with people and you really develop that relationship, I think you're in a better position to kind of work with them. But as a whole, it's very variable.
I actually see your position very similar to what we have on this campus. You're a teacher, you're a counselor, you're an advisor. You know, you're in a position where you really have to try to positively affect that patient, or everything that you're trying to accomplish.
Yeah,
it's pretty meaningless. You just can't if you can't get them there. It's, you know, if there's some way that you can convince them, what's in their best interest,
right,
then you've realized is it can't be me. It's not just a pill.
Yes. Another point I'd like to add, because I think is very relevant, is a lot of the staff have shared that, a lot of cadets and their trajectory in life was shaped by like a key moment, a key extracurricular activity, or a really significant teacher. So I think that's very formative. And then even myself, even though I didn't know I was going to be a physician, I was really into the sciences. So she's still here as a teacher, Dr. Robin Cowan. And then when she was here, Dr. Amy Coe. So I would spend all my time studying and just interacting with them. And I'm absolutely certain that that time and that relationship shaped part of my path. Yeah.
Mm-hmm. It's very interesting you say that too, because you left saying, look, I wasn't exactly sure what I was going to do, but hearing you now say that, if looking back,
yes,
you can say, well, clearly the sciences had a really profound effect on me. So, if we look back now in that crystal ball,
yes, of course,
we can now say, oh no, we did have a strong sense of what your path was.
Right.
Which I think is very interesting, because, for boys and parents to be thinking, you probably have some proclivities, some things that you tend toward, and for you to start exploring them in some greater detail, maybe worth it.
Absolutely. Yeah.
I think that's a great lesson, and we'll talk more to the boys about it after your talk. I think that'll be very, very helpful. When we do these discussions on Wednesdays, and we follow up. There's always picnic around the picnic tables on Thursdays and Fridays.
Oh, okay.
With follow-ups on these discussions, and what you think about this, or we get to actually talk to some boys who we know are very similar to you, and or whomever the speaker may be.
Yes.
And we really get to sort of lean in a little bit, and that's the point behind them, is to really be able to say, hey, why not have a moment where we can think about this in a little bit greater detail. You don't have to just think about this stuff when you're getting to that, adult place in your life.
Right.
And I think you're very helpful today to the boys. I think you created some peace with a lot of the boys, because when you asked them to raise their hand about, hey, what do you all know what you want to do? Maybe 15, 20% or so said, I think I know.
Yeah.
But a lot more hands that I'm not quite sure. A lot of those hands.
Yes.
And I think you alleviated some of their fears, because you told them that's okay.
Yes.
Right. It wasn't the case for me.
Mm-hmm.
I think the boys that will resonate with the boys. All right. You have now had a chance to, I'm sure you think a lot about these formative pieces.
Yeah.
And you were able, of course, to make, I think, very profound points to the boys today. were there any sort of subtleties, almost simple things that you bring? I mean, your uniform or how we formed up or anything like that you really thought, oh, this was really something that created a habit.
Oh, yes. Yeah, I didn't highlight it in my speech, but it would have been an excellent point where the things that they're doing just literally every day, especially, well, I did lightly touch upon it as a joke, like coming to formation, doing PT, late night formations, the parades, the things that they may not see how it'll shape up. It was just discipline that was being built. And discipline is like a muscle. You can build it up here. And discipline really was helpful in getting me through college, through medical school, through residency training, and it really will pay dividends in no matter what field or whatever you're doing in life. So by instilling that discipline, even if there's sometimes you veer off of it out of choice or not, it's always there. It's always a muscle that can be reactivated. And so that's another thing I would have loved to communicate just by showing up every day. Yeah.
Mm-hmm. I think that's such a brilliant point. We always think that there's something enormous, that it's this event, it's an epiphany. Mm-hmm. There's this thing that happens.
Right.
So it's like watching a movie. Yeah. Or it's a thunderbolt. And it's really not. Mm-hmm. It's an accretion. It's these little pieces, mm-hmm. one little piece at a time, mm-hmm. which I think is a very difficult thing, especially culturally now, because things come at you so fast and you want it so quick.
Yes.
So it's very difficult to say, let's just do the little things. Mm-hmm. Let's form up.
Right.
Let's get our uniform on. And watch how that makes a difference for you. Mm-hmm. It's a very hard lesson, and it's getting more and more difficult.
Yeah.
And it's great that you made this point. I think it's something that boys really have. All of us have to appreciate it.
Yes.
And like I said, it gets a little bit more difficult because you have this sense that things happen so fast, right? Mm-hmm. We have to break ourselves out of that mindset mm-hmm. often and say, no, it's just keep going. Yeah, let's just make sure every day is me.
Mm-hmm. I also want to touch on that point where when you said it's not often a big event, it's the everyday, the small moments. So I trained, my medical residency was, all 3 years was the COVID-19 pandemic. And of course, who is going to train for that? How can you be ready for something like that? But it is just the skills and the things that you have beforehand, and you're in that moment and opportunity. So I just kind of took that. And in the speech, I shared about courage. And courage wasn't having a lack of fear, but being able to do something and show up despite that fear. So I was able to at least still scour the internet and share with my colleagues, even if it was small. I wasn't maybe saving the entire hospital, but I'm sure it made a big difference because the hospital ended up taking me and my roommate's admission template that we created, and they standardized it throughout the hospital. And then I also want to touch, I've heard it in Army Navy, and then I've heard it throughout my whole life, is at moments of high stress, you fall back to your level of training. And that applies in anything. Of course, absolutely military operations, but even as a skill as a doctor. So that's why we always study the basics. We train and study all the time. So it just becomes subconscious. So when that big moment does happen to happen, you already are as ready as you can be.
Beautiful.
Mm-hmm.
I do not want to say another word. That was that I need to stop right there. Dr. Wade Licup, mm-hmm. Thank you for what you did today with the boys. Thank you for what you'll continue to do. You've agreed to continue to stay, act as a mentor whenever you can for the boys. That's wonderful.
My honor and pleasure.
And, we Major General Barton always used to say that our boys are our credential. Mm. And you, of course, are clearly our credentials. And thank you so much.
Thank you. Very kind words.
We appreciate it.
My honor.
Thank you.